My name is Mohammed Akod. I'm the chair of the Department of Transplantation and Hepatobiliary Diseases at the Lahey Hospital and Medical Center. There is a big discrepancy between the number of available organs for transplantation from deceased donors and the number of patients on the waiting list. Living donation offers an option for patients who face a lengthy and uncertain wait. Because of the shortage of deceased donor organs, the living donors offer recipients a timely, life-saving transplant without having to endure the uncertainty of waiting for a suitable organ. Moreover, recipients can be transplanted early before their disease is too advanced. Once the recipient is accepted for transplantation, donors can then fill a form and evaluated as potential donors. If accepted, then the transplant can be scheduled when the recipient is in optimal medical condition, making their recovery faster.
Hi, I'm Dr. Beth Boutot, and I'm the director of the Live Kidney Donor Program. When someone's kidneys fail, the only treatments for this are dialysis or kidney transplantation. Hemodialysis involves going to a dialysis center 3 times a week for about 4 hours, where someone's blood is cleaned through a dialysis machine and then returned to them through a catheter or through a shunt in their arm. Dialysis is very time-consuming, and many patients still feel lousy, exhausted, tired after this process. However, patients in most age groups live longer and have better quality of life with kidney transplantation. There are 2 types of kidney transplants: a deceased kidney transplant and a living kidney transplant. A deceased kidney transplant is from a person who dies of either natural causes or from an accident who donates their organs. In order to get a deceased kidney transplant, a person has to be on a deceased kidney donor waiting list. Typically, it is a 7 to 9 year wait on a deceased kidney donor waiting list for a kidney transplant. Living kidney donation is a kidney from a friend, a relative, a neighbor, a coworker, someone that's been screened to be a kidney donor. Typically, a kidney donor operation can occur within a few months of a donor being evaluated, and often this can even occur prior to a person having to start dialysis. So this is the benefit of live kidney donation. It can be done in a relatively short amount of time without all of that waiting on the list for a kidney transplant. Our transplant medications have improved over time, so a live kidney donor transplant doesn't just have to be from a relative. It can be from a friend, a neighbor, or a coworker. At Lahey Hospital and Medical Center, we have an excellent living kidney donor program. We have excellent outcomes for our kidney donors, and most are able to leave the hospital after 3 days. Our kidney donors are thoroughly screened by physicians and surgeons. They have urine testing, blood testing, chest x-ray, EKGs, abdominal CT scans, and antibody testing to make sure they are compatible with their intended recipient, and also to make sure it's safe to go their whole life with 1 kidney. The kidney donor surgery is performed by well-trained surgeons, and the procedure is done laparoscopically, which has been shown to reduce the post-operative recovery time. Kidney donors are followed for a minimum of 2 years at Lahey Hospital and Medical Center until they're determined to be stable, and at which time they're transitioned to their primary care physician, who will do kidney testing for the rest of their life. Our kidney donors are able to return to work once they heal, and they're able to resume all of their regular activities. If a potential kidney donor is not compatible with their intended recipient, we participate in the National Kidney Registry Exchange Program, which offers another option. Through a matching process, the National Kidney Donor Registry can match a potential kidney donor with a recipient at another transplant center, and another potential kidney donor could donate to your intended recipient. Some of my patients say to me that they're not comfortable asking someone to be a potential kidney donor. So I typically say to them that when they're comfortable, to discuss with their friends, neighbors, family, coworkers that they do have a kidney disease and are going on a kidney transplant waiting list. Sometimes this is enough for a person to come forward and offer to be their potential kidney donor. And often it's someone that they did not expect to come forward. Other patients create social media pages, for example, on Facebook, where they tell their story and invite people to be their potential kidney donor.
Hi, my name is Tony. I'm a live donor nurse coordinator here at Lahey Hospital. People want to become kidney donors for all sorts of different reasons. Sometimes there's a family member or loved one who needs a kidney and you want to help them out by being their donor. And sometimes people want to donate their kidney to somebody that they don't even know, just to give a donation and to give back. And here at Lahey, we work with all types of different donors that come to us for different reasons of wanting to donate. Everybody goes through the same evaluation process. The process starts off with filling out a health history questionnaire, and that website is www.lahey-livingdonor.org, where you will fill out your medical histories, medications you take, and that history is screened by one of our live donor nurse coordinators. Once we screen your health information, we will give you a phone call, usually within 7 days, and we will go over your information with you. If everything looks good, you will get some labs to do, which we can have you do here at Lahey, or you can have them done at Quest Diagnostics if that is more convenient for you. Once we get those lab results back, they're reviewed with one of our nephrologists, and as a team, we make a decision as to whether we do a full evaluation, which is done here at Lahey Hospital. Some of the things that are required for you to be a kidney donor would be that you have to be 18 years old. And there are some things that would not allow you to be a kidney donor, which would be some forms of cancer. We have different requirements for the form of cancer and how far out you might have to be from any type of treatment. Uncontrolled high blood pressure. You can have a well-controlled blood pressure on one blood pressure medication, but if you have to take 2 or more medications, that would rule you out as a kidney donor. Diabetes, you cannot have diabetes if you want to be a kidney donor. There are other things that we need to check for when we're going through your health history. We want to make sure that there's no coercion and that there was no exchange of money and that you're not pressured to want to be a donor. That is very important to us, that it is a choice on your own to come and go through the donor evaluation process. We have to make sure that you don't have any active infections, including HIV. You have to be at least a year out from pregnancy. And also if you donate, we recommend you wait an entire year before you try to become pregnant again. We do have a body mass index cutoff of 35. Another requirement is that you're up to date with your cancer screenings. We follow the recommendations of the American Cancer Society. For women over 40, that's your mammogram and pap smear. Colonoscopies are due for men and women at 45 years old now. And also for men, there is screening called a PSA test to screen for prostate cancer. Once a donor gets through their initial screening process, we decide as a team that they would come in for a full 2-day evaluation that is done here at Lahey Hospital. It is a very thorough physical evaluation, and it's full of a lot of appointments and tests. You'll meet with each member of our team, which would include a surgeon, a nephrologist, a nurse coordinator, a nutritionist, pharmacist, social workers, and the first appointment you have in your evaluation is with an independent live donor advocate, which is your advocate throughout this process, who will explain the process to you in detail and make sure you know that it is completely voluntary and that you can back out at any time. Even if you go through evaluation and you're accepted for surgery, we want you to be comfortable with the process at all times. Once you get through your 2-day evaluation here at Lahey, we meet as a team to make a decision as to whether kidney donation is safe for you. Once we make that decision, we'll let you know right away. And if it is a safe decision for you, we can start to plan your surgery. The surgery itself usually takes about 4 to 6 hours. It's done laparoscopically, which is a couple of small incisions, and one incision is made just big enough to get the kidney out. Most donors are in the hospital for 2 to 4 days, and the recovery process does require 4 to 6 weeks of no heavy lifting afterwards, which is no more than 5 to 10 pounds for 4 to 6 weeks. This is something to take into consideration if you have a very physically demanding job. Following the surgery, we will have some follow-up appointments that are really important. We want to see you 2 weeks after surgery to make sure you're healing well. And then we'll see you 6 months after surgery, 1 year after surgery, and 2 years after surgery, just to check in and make sure you're doing well.